So we look at patient age. This is probably one of the most important things that we can look at initially when we look at a lesion. Because depending on the age of the patient, there are certain lesions that you're going to include in the differential, and certain lesions that you're not or never going to include in the differential. For instance, for the benign lesions, e.g. non-ossified fibroma, unicameral or simple bone cyst, and chondroblastoma pretty much only occurred in the skeletally immature or the age of the teenage years. Whereas if it's a giant cell tumor of bone, these only occur when the physes are closed. So if you see the same exact lesion, but one is in a 10-year-old versus one is in a 40-year-old, they can have very, very different differential diagnoses, and the lesions would be different. For malignant lesions, the same occurs as well. Multiple myeloma metastases are going to be in the older age group, virtually unheard of under the age of 40, or very, very unlikely. Whereas Ewing sarcoma and osteosarcoma, it's pretty much going to be in the younger age group, although there is a second peak of osteosarcoma in the older adults, or in sarcomatous transformation. Neuroblastoma net is going to be probably the most common metastases in an infant or very young child.